Hello, everyone. Thank you for tuning in. If you're tuning in via Zoom or on Facebook, thank you very much for taking the time tonight. My name is Pete Lucas, and tonight's discussion is on same-day total joint replacement surgery brought to you by University Orthopedics. So before we begin, we'd like to mention that this video content has been made available for informational and educational purposes only. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. So tonight we'll take a deep dive into same-day total joint replacement surgery at the East Bay Surgery Center at Kettle Point. You'll hear from a distinguished panel of experts who are nationally recognized for their work in adult reconstruction surgery. We will then have time for you at home to submit your questions, and we will do our best to get to all of them. University Orthopedics has locations throughout Rhode Island and now in Mansfield, Massachusetts. A regional center for orthopedics, sports medicine, and rehabilitation, University Orthopedics includes more than 45 board-certified orthopedic, fellowship-trained musculoskeletal and sports medicine physicians. All physicians at University Orthopedics are on the faculty of the Warren Alpert Medical School of Brown University, where they train the next generation of surgeons. Tonight, we're joined by a special team of surgeons from the Total Joint Replacement Center at University Orthopedics. Dr. John Froelich, Dr. Eric Cohen, Dr. Thomas Barrett, Dr. Derek Jenkins, and Dr. Valentin Antoci. Thank you all for taking the time tonight to be here. Now, we have a reason to celebrate. This team has just accomplished another milestone at the East Bay Surgery Center. Recently, this past month, celebrating their 300th same-day total joint replacement surgery. It's taken less than 2 years to get to this point, but this process began long before this. And we begin with Dr. John Froelich, who will give us a bit of the history behind what his team has accomplished and where you are today. So Dr. John Froelich, thank you for being here and tell us a little bit about the history of this procedure.
Thank you, Peter. So although the perception is that this is a new and innovative process, which it is, its actual roots go back many, many years. All of the doctors here are participants at the Total Joint Center over at the Miriam Hospital, which is now celebrating its 10th anniversary and has done probably over 14,000 hip and knee replacement procedures. And it's an integrated approach, which is what we have borrowed upon and developed further at University Orthopedics for our outpatient program. For example, 10 years ago, a total hip or total knee patient on average stayed in the hospital just less than 4 days. Now, even at that facility, the average length of stay is 1 day. Similarly, when the program started 10 years ago, approximately 70+% of people ended up going to a nursing facility or a formal rehabilitation facility. Now that number is less than 10%. So it's through an integrated approach and really addressing all the details that we've been able to streamline the process, yet assure that all the patient's needs are met and that it's done in a completely safe and effective manner. And so we've taken that process and refined it yet more, which some of my partners here will discuss further with you shortly, to the point that now in a select group of people, and I think that's one of the takeaways that you'll hear from us, that in a select group of people, now it's feasible to have your total joint replacement done on Tuesday morning and have dinner with your family at home Tuesday night. Yet all your needs are going to be met in a safe, efficacious manner. And I think that's what we're always trying to achieve. So that's something that's now available both through hospital stays, but also now through our outpatient facility.
Great, thank you, Dr. Froelich. And we'll get into the procedure a bit. We'll start with hip surgery. And Dr. Eric Cohen, you've specialized in surgery of the hip. You've trained and spent your career focusing on this, knees as well. But why don't you take us through the hip procedure and tell us a little bit about yourself and your background.
Absolutely, thanks, Pete. Yeah, so I trained at Brown and did my orthopedic residency at Brown, and then stayed on and did a trauma fellowship, and then the adult reconstruction hip and knee replacement fellowship also at Brown. So I've been at Brown for all of my orthopedic training, and then traveled around the country learning from some other hip surgeons regarding the anterior approach. So I certainly have an interest in anterior approach hip replacement, also knee replacements as well. I put together a quick PowerPoint, not to bore you, but just to give some visual information on what is a hip replacement before we start talking about going home after hip replacement. Total hip replacement or total hip arthroplasty. So who is a candidate for this procedure? It's patients with severe hip pain caused by a couple disease processes. One is osteoarthritis, which is really wear and tear of the hip joint or loss of cartilage. You can see on the top there's an x-ray of a patient with a normal joint space. Cartilage doesn't show up on x-ray, so it actually shows up as a space. And then as you lose that cartilage, it becomes bone on bone, or the common saying is bone on bone arthritis, and that's what we can see on the right side as an arthritic hip. A similar process, but different in some ways, is avascular necrosis. And avascular necrosis is interruption of the blood supply to the hip, and what can happen is the hip then collapses, or the roof kind of falls in, and you can see a normal radiograph on the left, and then on the right you can see kind of a mouse-shaped head. Both cause extreme hip pain, disability, difficulty walking, limping. Pain is often located in the groin, and that's when patients often seek our help and care. So a hip replacement is the most successful operation in orthopedics, really defined by clinical outcomes and implant survivorship. And what a hip replacement is, it's made of a metal or titanium femoral component, ceramic or metal femoral head, a titanium acetabular component, and then a plastic liner, which is a highly cross-linked plastic liner, which has low wear characteristics that snaps into the cup to make the smooth surface with the head. So that is what a hip replacement is. It can be cemented in, or it could be press fit in, which is wedged into the bone, and the bone will then grow into the implants, adding to its longevity. The hip group can be replaced through a variety of surgical approaches: anterior approach, lateral approach, or posterior approach. Anterior approach is from the front of the hip, lateral approach is from the side, and posterior approach is from the back. And I think what's most important is having a fellowship-trained hip surgeon replace your hip. Regardless of approach, the outcomes long-term are the same, and we're happy to offer all surgical approaches by fellowship-trained hip replacement surgeons at University of Orthopedics. So a lot of the information I gave you can be found on our University of Orthopedics blog, as well as American Association of Hip and Knee Surgeons has a great patient care education website. That's the middle link. And then the bottom is the American Academy of Orthopedic Surgeons, which also has a plethora of information. I would say these three sources are key and good sources for your information. And I'm going to let Pete take it away. I think Tom's going to talk about the knee here briefly until we get into the East Bay Surgery Center.
Great, Dr. Cohen, thank you. We know it could take hours to go through that procedure. You did it in a few minutes, so thank you for doing that. And Dr. Barrett, we'll talk with you about the knee procedure. Tell us a little bit about yourself and go through the knee procedure, please.
Happy to, Pete. Thank you very much. So I did my residency training in Albany, New York, and then went on to do an adult reconstruction fellowship in hip and knee replacements and revisions at Baylor in Houston. And I was happy to join the faculty here a few years ago. I'm going to talk briefly, very similar to what Dr. Cohen did about with the hip, and only in regards to the knee. So knee replacement is used to replace the damaged surface of the knee only, which essentially are replacing the worn down cartilage and bone with a prosthesis, with the goal of relieving pain, increasing mobility, and allowing our patients to return to normal everyday activities. Similar to the hip, the two components that interface with the bone on the femoral side is a metal cap. Usually this is cobalt chromium, although non-allergic metals can be considered also, with a titanium sleeve on the tibia, and again, a highly cross-linked bearing surface. And again, this is very low wear characteristics. allows for the articulation. Knee replacements are very well tolerated. Patients do really well afterwards, and we've been happy to have great success with them here at the surgery center. I think to take a step back and think about what will lead our patients to successful outpatient surgery, the most important thing is selecting the patient based on very minimal medical comorbidities, discussing risk, benefits, and alternatives, and educating the patient on what to expect while preparing for the surgery, undergoing the surgery, and afterwards. This requires a lot of support from family and other outpatient care services. You need an expert team that works well together with good experience based on really well-defined pathways regarding a whole bunch of issues that can come up afterwards. And I think that will set things up for Dr. Jenkins to talk about kind of what goes into considering hip and knee replacements as an outpatient.
Dr. Barrett, thank you for that brief description. And again, we know that you could talk for hours on that, so thank you very much for that. Dr. Jenkins, we'll go to you on who is a good candidate for this procedure. Please tell us about yourself a bit and tell us who is a good candidate.
Yeah, thanks, Pete. My Dr. Jenkins, I did my undergraduate engineering school and medical school up at Dartmouth in Hanover, New Hampshire, and then did my orthopedic training at Lenox Hill Hospital in New York City, with a pretty significant experience with the direct anterior approach to total hip replacement, which is predominantly the approach that I use, although I use all the surgical approaches. And as Eric said, in certain instances, I think that they all have excellent outcomes, and we offer all of them here. I did my adult reconstruction training at the Mayo Clinic in Rochester, Minnesota, and then I've been here for about 7 years now, and so my topic is who's a good candidate for outpatient total joints. But I guess first, the idea behind doing outpatient total joints, looking back at a certain subset of our patients, there are many patients that just spent the night in the hospital and nothing really happened that night. They slept in an uncomfortable bed, and they woke up in the certain periods in the middle of the night, and woke up in the morning and got stuck with a needle and got their blood tested, and then got physical therapy and then went home. And so our thought was, why not skip the middleman and just in a certain proportion of patients, who are healthy and younger and active, to send them directly home. And so, that was the premise behind this. And we're very careful about those patients that we offer the surgery to. But that was the idea. And it was based on some of these protocols that have been used at other institutions for years. And so we're not the first we're the first in Rhode Island to do it. We're not the first in the country or the world to do it by any means. And so, what we're doing is based on a groundwork that's been laid by, some other excellent surgeons at other institutions. And so we've really, learned a lot from them and are grateful for that. But basically, a patient's identified in the office as a candidate, and that will be based on their medical history and medical problems and, other factors. And a long discussion, will be had with the patient and the surgeon in the office, and a mutual decision, will be made as to the best location for their surgery. And I would say for all of us, the majority of our patients are still done in the hospital, but our volume in the hospital has actually increased since we started offering this 2 years ago. But for a certain subset of patients, they choose the convenience of surgery in a surgery center as an outpatient. And they've had great experience. We have a pre-op class. We have them tour our physical therapy facilities, and we work very closely with their primary care doctors to make sure that they're optimized before surgery. So there's a lot of thought and work that goes into preparing them for surgery. And on the day of the surgery, patients come in. We do the surgery. It lasts about 2 hours. They recover in our recovery room. We have excellent nurses and perioperative staff, and OR staff that I'm really grateful to work with, and then patients recover in the recovery room, and after a few hours, they take a car service home. It's just a great experience. And then at home, visiting nurses and physical therapists meet them there. It's very well organized, and there's a safety net involved too. That if anything were to happen, there's an emergency phone number that they can call. So just a tremendous amount of thought has been put into trying to make this as safe as possible and as convenient as possible. And I know that Dr. Antochi wanted to talk a little more about the concierge care. My 2-year-old is trying to join me here. Sorry about that. It's bedtime, and he doesn't want to go to bed. But Val, I guess if you want to talk a little bit more about the concierge care and the post-operative management, it's all yours.
All right. Thanks, Dr. Jenkins. I'm Val Antochi. I'm one of the total joint surgeons with the University of Orthopedics and Lifespan. Previously, have been trained through the Harvard system in Boston and completed the adult reconstruction and total joints fellowship at the Massachusetts General Hospital. As Dr. Jenkins said, I think outpatient joints are superb, and it's more than just outpatient joints. They're in office, basically total joints, completely safe. Same procedures you get at the hospitals, but instead of having to go, stay in a bed and eat hospital food, you get to have dinner with your family, as Dr. Froelich has referenced earlier. The whole concierge concept is having somebody who really knows you. And I think all my patients will agree that, University of Orthopedics has set up a setting where everybody knows you. From the moment you walk in, to the car driver that takes you home, to the visiting nurses and physical therapists that then meet you there, it's a very personalized experience. In rare occasions, I have gone myself in order to get the patient from the car down to their house, see their house, make sure that they are safe, make sure that their living room is okay, helping them turn the TV on and putting it to the right channel. And that's what we're offering here. I think it's very unique. I think it's, even though it's something that has been done in other places across the country, just like everything in Rhode Island, somebody knows somebody. I think, here we all know you. Whenever you walk in the door, we're there for you. So, when you're ready to leave the facility, a physical therapist makes sure that you walk up and down the hallway, make sure that you do stairs. That means that you can probably get out of the bed at home, go to the kitchen, get your own sandwich, walk to the bathroom, be pretty independent. A limousine takes you home. Basically, especially everybody was worried with COVID and everything. Well, you have a car that's been sterilized. It's not somebody out there, dragging you through hallways. They know you. The driver knows exactly who they're picking up, and they're going to take you home. You don't just go home by yourself. We send a CNA, so a nursing assistant, that basically will hold your hand to make sure that you're comfortable getting home. At home, you have the physical therapist and the nurses meet you. They make sure that, again, you walk into the house, you're comfortable with daily tasks. So the evening of the surgery, you already know how to walk around your house, how to get to your living room, get in and out of your bed, walk to the bathroom, and have all the safety measures in place in order to make sure that you are successful. Because guess what? If you're successful as a patient, that means we are successful as a surgeon. We are successful as a group. We are successful as University of Orthopedics. So we have direct interest in your success. And that's what basically the concierge approach to total joints is.
I think setting them up for success is part of the education that's provided. Dr. Froelich, a lot of thought and planning has gone into this educational program that you provide for the patients and for their families. Can you talk about what they go through in that tour that they do ahead of time of the facility and the class?
Sure. And as I think you point out, Peter, this is really the crux of starting a whole process that is very thoughtful and to the point and meets everyone's needs. So every one of our patients is screened through a medical, what we call a medical passport, so that we make sure that we are selecting the right people, and an anesthesiologist who works with us closely will review that as well. All of our patients then will attend a formal education program, which really encompasses about an hour and a half to 2 hours of time, but it goes through in a very systematic way what is going to happen at different points. So there's no surprises, and it alleviates anxiety and concerns, and it addresses any concerns that may come up. And that is done by a nurse practitioner from University Orthopedics, specifically Steve Propetier, who has really been a workhorse in this regard, and sees to it that patients are scheduled appropriately and that all their needs are met. And so those needs are to make sure that their home is ready for it. Another issue is medications. All of our patients get their medications beforehand, and it's explained to them what those medications are for, so that if they have pain, they know that this is what they'll be taking. If they were to have some nausea, we address that. Constipation, all the different things that are side effects, if you will, or part of the recovery process. So I think that's very, very important, and a significant amount of time and effort is put in because we know by doing that, it will assure that our patients are comfortable and that no one drops the ball, so to speak, and that it will be a seamless process. And just like Dr. Antachi spoke of, really everything is coordinated through our schedulers, as well as the educator, as well as the plethora of other people that are involved in this process. So it's a real team effort. And I think, scheduling of the limousine, but these were things that we didn't have to do, but we felt this is the way that we can assure that our patients are taken care of optimally and to the utmost safety. And we will never compromise that. And that's something I think we're all very proud of. And our track record, I think, speaks for itself in that we have 300 plus patients now that have been just thrilled with the entire process.
And as you close in on 350 procedures, you have some folks to look back at and ask them about their experiences of returning home, and that's the goal, to get them home. Studies have shown, Dr. Cohen, that patients recover better in their own homes. Now that you've seen several hundred go through, what's the feedback you've heard, and why do they recover better in their own home?
Yeah, no, that's exactly right, Pete. And there's a great New York Times article that highlights that there's no place like home after total joint replacement. And I think that's certainly true. And patients get better night's rest. They tend to mobilize quicker, seem to have less pain because they're mobilizing and getting up more. And all of that can be done safely at the home. My patients have been thrilled. It's been wonderful to hear their feedback, and a lot of it is kind of what the whole team is alluding to, in that this is patient-centered or patient-centric, and so they were impressed that everyone knew their name. They felt like kings and queens, where everyone was really focused on them and waiting on them before surgery and after surgery. They had a great experience with the home health agencies that we've partnered with. We really are selective in our home health agencies who are working with us on outpatient total joints. They all have our protocols. They all have our phone numbers, and patients will give us a call if there's an issue. The home healthcare agency will give us a call if there's an issue, and we're really available 24/7. And I think that what this program has done is really allowed people to feel comfortable and recover at home and in the peace and quiet of their home. And that's really the goal. That's what we all set out to do. And it's been an absolute pleasure to see these patients back in the office after surgery and get this feedback.
Great. And Dr. Barrett, a big part of that team is the OR staff that you've all put together at the East Bay Surgery Center, really focused on orthopedic procedures only. Can you talk about how important that staff is that you work with as you do these same-day total joint surgeries?
That's a great question, Pete. I think, as you can tell from what we've talked about so far, that this really does require a full multidisciplinary team approach to make this work effectively. This really starts with us and our staffs in the office, making sure that the patient gets set up appropriately, but then progressing into the surgery center, they're met by one of our preoperative nurses. They get their IV, get set up for surgery by people who know who they are and what they're there for. We see our patients before surgery. They're met by the anesthesiologist that was involved in their screening. They have their operation, and the second they wake up on the other side in the recovery room, the recovery room nurse hands off and knows exactly what to do with them. These are a specialized group of folks that know exactly how to mobilize patients after a total joint replacement, where we can do this safely and effectively in a surgery center with the same view that's behind Pete. This is a big deal for us, and being able to coordinate this with a group of experts and in perioperative nurses that really do drive this process along with us.
Great, and want to encourage those at home watching to please send in questions. It's very rare that we have a panel of adult reconstruction surgeons together from University of Orthopedics, so they're all ready to answer your questions, so please take advantage of this. Safety is always a big concern. We've talked about this, and I know it's a top priority. Dr. Jenkins, talk about safety. You talk about it all the time. Why is that the top priority, and talk about that at the East Bay Surgery Center?
Yeah, Pete, that is probably the most important point. These patients have great experiences, and it really is like a concierge service. It's like being in a 5-star hotel. It's unbelievable, just the extent that, how, we treat patients with respect and care and just go over the top. It's, an unbelievable experience, but, really where the rubber meets the road is it safe, and we, the surgery itself, we use the same techniques, the same implants. We, to some degree, are able to choose although the anesthesia group that we work with is the same anesthesia group that we work with in the hospital, we get to have some say in those that may be more facile and the most advanced anesthesia blocks. We do spinal anesthetics. We do the fanciest, most cutting edge pain blocks for the quickest recovery. Really, we're able to kind of optimize the entire experience, because it's our place, but safety, we've looked at, for me to transition, outcomes are very important. So for me to transition, a proportion of my practice to the surgery center, it's not something that I did lightly or without a lot of thought, or any of us did. In the appropriate patient, based on multiple studies that have been done in other similar situations with similar practices, it's been shown that, in their experience, patients, were able to have these surgeries done very effectively with similar implants, excellent outcomes, in some ways even better outcomes than with an overnight stay in the hospital. And so we based our protocols on those procedures and protocols that had been proven in the literature, and we put a lot of thought into that. We've also found that in our experience too. So, we have over 300 total joints. We weren't quick to advertise this, but we have multiple patients now that we've operated on safely, with really a lower side effect profile or complication profile compared to the patients done in the hospital. Now, to some degree, that's a little bit unfair because, those patients that we would do as outpatients, are less, there's a lot less risk. The pretest probability of complication is low. That's true. Our experience now with hundreds of patients has been not only a great experience for the patient, but successful surgeons, successful outcomes. So very, very important that, that be the case for us to take the leap to doing patients in the surgery center. And again, based on data, studies, literature, that have been done in the past, and now we have our outcomes, which eventually we'll publish, that show a similar thing. Of course, better though, because we would of course say that we're unique and better. As far as outcomes and complications, it's been very favorable and safe.
And really, it is a unique setting. If you look behind me and behind Dr. Antochi, Kettle Point is really unique in Rhode Island and really in New England to have a medical facility on the water that's designed only for orthopedic care. Dr. Antochi, tell me about, for those who have not been to the building, from the first floor to the fourth floor, what there is and why it's an ideal place to come have a procedure, and even for a family member to come along with that patient for the day.
Thank you. I just wanted to echo again, the previous comments. I mean, safety and quality is all about control over all aspects of what we do. And that's the benefit of same-day office-based total joints, is that we control everything from education to the experience in the operating room, to the staff that we work with, to the partnership that we build in and out of the facility. So, as part of that control is this new beautiful facility. It's right behind me there. It was built to really be the state-of-the-art medical facility. We used one of the top, medical building architects in the area. It's a fantastic, brand new place that has everything within it. So we now have our own urgent care that focuses on musculoskeletal emergencies. Patients come in all the time with broken ankles, with new complaints, with anything that needs to be taken care of from that perspective. We have within University Orthopedics MRI, X-rays, as well as other advanced images. We have physical medicine and rehabilitation doctors that are facile with using ultrasound and rapid diagnostic procedures, as well as interventional radiology type procedures. So you walk into the door and you'll see everything is brand new screens, new technology. To the right, you're gonna meet, you're gonna have even your sandwich and your cake, and literally, not to say anything, but have your sandwich and your cake and eat it too, kind of thing. And guess what? That's the food. It's not hospital food. It's a fancy restaurant from Barrington that brings in your food for your lunch after you have your total joint at University Orthopedics. You go to the second floor, and that's where the operating room is. You see your physician on the first floor. That's where I see patients. That's where the total joints division sees patients every day. You take a couple steps, or you take the elevator to the second floor, and we have beautiful, brand new operating rooms certified to the highest extent possible, including most of the available technology. The staff there is always smiling. I swear, every time I walk into the facility, everybody's happy. Everybody's ready to take care of stuff. You go to the third floor, you got more offices, more places to see. Fourth floor, beautiful. Glass wall of windows. That's where you can do your physical therapy. Literally, patients look, just that view that you see in my background, you see in Pete's background, that's the view that they sit on a bicycle and they kind of zone out and spin for the 5-10 minutes as they warm up. Then the physical therapist picks them up and really, cranks them through the motions and everything they do. So it's a brand new facility. It's easily accessible. I mean, you can see it from the bridge, 195 bridge, as you cross into Providence and out of Providence. You look to your right down the river and you'll see our facility, University of Orthopedics. You're at the hospital, you look over the river and you see University of Orthopedics. So prime location, easy access, close of the highways, probably less than 5 minutes of the highway. So you get unique experience, well-controlled, very safe, and great location. What else can you expect?
Dr. Antochi, we did get a question about home care and what sort of care is provided at home. So I'll ask you that one as well.
And again, just like I mentioned a second ago, it's all, to me, it's all about making sure that as a surgeon, I mean, I know people think as surgeons that we like to be in control, but that's exactly how you achieve the results. I want to make sure that what we do, that I understand what we're doing, and making sure that we have control over all aspects of it. And that's the benefit of the home health agencies that we worked with. It's not one agency. At this point, we are open to work with all agencies as long as we can form a partnership and approve and expect the quality that every patient gets, meaning that either the patient gets there at 1 o'clock or at 5 o'clock or at 6 o'clock in the evening, they're going to be met by a smiling nurse, and a happy physical therapist in order to make sure that they are safe, make sure that their vitals are good, that their medications are in place, that they're able to walk the stairs, make it into bed, make it to the bathroom. And that's what I care about. I care about the people that we work with. So the visiting nurses, the physical therapists are people that, have my cell phone directly, have Dr. Jenkins's cell phone, Dr. Froehlich. We get a phone call every night and we talk to them being like, hey, your patient is tucked in, everything went well, they did the stairs, they went to the bathroom, I'm very happy. And I'm gonna check on them first thing tomorrow morning. So at 8 o'clock, 7 o'clock, they get back there, they check on the patients. And that's a unique partnership that we were able to accomplish by providing that concierge type of care, by providing the control over every minute detail of the process.
And I think that surprises a lot of folks that they do have that direct contact with you, which makes them feel very comfortable. It's rare to get these 5 experts together, so please send us for questions. And I've got one, Dr. Cohen. We are getting into the springtime. Folks are getting outside for the first time, and maybe months to garden, to walk around. When should someone think about addressing that pain, seeing a medical provider like yourself, whether it's hip or knee, if they're out there, getting out there for the first time, when would they want to see a medical professional?
Yeah, I think if you're having hip or knee pain and you're not able to do the gardening, or not able to play with your kids or grandkids, or go take a walk on the park, if you're having significant hip pain, which is typically groin pain, but can be kind of in the back and buttock pain as well, or knee pain, then you should seek help and evaluation by one of the adult reconstruction surgeons here. Doesn't necessarily mean you need a joint replacement, but I think knowing what you're dealing with, and there's other non-operative modalities that we can do so you can enjoy your spring and summer in Rhode Island, which is, I know, what everyone's looking forward to these days, is important. And so come in for an evaluation. Typically an x-ray is obtained, and then a consultation with one of us.
Great. And we had a question just come in, Dr. Cohen, I think, which would be perfect for you. If a procedure is underway, anterior versus lateral, with a hip replacement, can that be modified once the procedure is underway? Is it something that can be determined on the table?
Yeah, so this is typically determined preoperatively and planned. For each approach, there are special instruments that are used. For anterior approach, there's a special table called the Hanna table, which we do have at the East Bay Surgery Center for anterior approach. So that's planned ahead of time with the surgeon, and I think having a discussion about the different approaches, what that surgeon prefers to do for hip replacements, and kind of having the discussion ahead of time preoperatively is probably the most important.
Great. And Dr. Barrett, I have a question for you that came in. Is there harm in waiting too long for a hip or knee replacement?
It's a tricky question to answer. Certainly it's based on the patient's function, based on their quality of life. I don't think that, in this day and age, people should be waiting so long that they suffer and have worsening pain or loss of function, and they're not doing things that they want to do, like golf, walk, or garden, especially as the weather's getting warmer. I don't think that there's certainly, any reason to suffer that loss of function at all. Certainly with COVID, and I think a lot of people did delay their care, and I don't think that presents for us any insurmountable problem. I just think that the patient really and their loved ones are the ones that are suffering with that loss of function and pain and all that comes along with arthritis.
And Dr. Jenkins, I think of a patient we did a feature on a couple of years ago who you put a new hip in, and you said, hopefully we'll only do this one time. Avid runner, got back to doing things. So my question for you is, what sort of activities can a patient get back to after a total joint replacement?
Yeah, so a lot, and every surgeon is kind of, every surgeon is different in, the restrictions that they would recommend, And I say recommend because people are going to do, whatever they're going to do. I can't, like my kids are going to, I'm a guide. I tell my 7-year-old, I'm not your boss. I'm your guide. I'm trying to guide you in the right direction, trying to give you some advice based on my experience and what I've seen. And so, that's really all we can do is kind of try and guide the patients to the point where they don't have some kind of complication or their joint wears out early. But one of the patients or one of the questions to the panel was also, why do you, what drives you? Why did you do this job? Why do you love this job? And I love this job because, we get to kind of push the envelope to some degree. And Pete, you had mentioned that, it's rare to get, all these orthopedic surgery, adult reconstruction fellowship trained specialists together. Well, guess what? We do this every Wednesday morning. All of us get up at 6 a.m. We have conference with our fellow and visiting professors from all over the country. And, and we bounce ideas off one another and we're collegial. And something that we don't really talk a lot about, but being part of this group in University Orthopedics is that, it's not just one guy, and, we work together as a team, and we kind of bounce ideas off one another. And so what really drives me is working with like-minded individuals trying to push the envelope. And so, what can patients do? They can do a heck of a lot more than they could in the past. And so what do we let them do? A lot of times, patients go back to skiing, and again, it's kind of different per surgeon, but, I try and tell patients to, not ski the black diamonds or the frozen bumps. Sometimes they do. I prefer they don't run marathons, do Ironman competition, stuff like that. Is any kind of, repetitive loading is going to lead to likely earlier wear and failure of the joint. Now my background's in engineering, so I'm really fascinated by a lot of the materials that are used, and so the materials have really come a long way with the highly cross-linked polyethylenes, ultra-high molecular weight polyethylenes, and so they last a heck of a long time, but they don't last forever. Any wear part, any kind of bearing, has a finite lifetime, and so depending on what the patient does and how for what period of time, would then lead to the longevity of the joint. So patients are doing all kinds of stuff that you wouldn't imagine, water skiing and, doing, climbing mountains. And, I had a patient send me pictures of him hiking, going to traveling in the Galapagos and carrying a backpack and and his grandson. And so I think that, these are really life-changing operations. And, it's for us, it's really rewarding to try and, is to share in that transformation with patients and in, being able to, help them get back to doing all these things that they did at one time or always wanted to do. And it's transformative and life-changing. And, for us, it feeds your soul. It's the coolest job that there is, I think.
Climb Mount Washington, how about that? That came in on Facebook, one of your patients chiming in. So there's another example. We had a question come in also on Facebook. Dr. Barrett will ask you this one. Is there an age cutoff for joint replacement operations, and are there qualifications? And as a person feels, as opposed to their actual age, is there a difference there?
So I think that, there's two ways to answer this. One is for joint replacement specifically, there's really no specific age cutoff or age limits. Generally, this tends to be, a group of motivated patients that want to feel better, that have suffered some loss in their quality of life or function from their arthritis. I think specifically for an outpatient procedure, we tend, and this is where this goes back to safety, we tend to select patients with a lower amount of, minimal medical problems, with good support at home, optimized medical issues that see their primary care doctor regularly, because that's very important as far as ensuring the safety of this procedure being done outside of a hospital. On a bigger picture, there's really, with the support of a hospital, there's really no limit as far as age goes. This is all based on, a discussion with your surgeon and your medical doctor.
Great. We're approaching the 1 hour mark, so we'll take any questions that come in if we can, but I think we'd like to go around to each one of you and ask you maybe what some of the feedback is that you remember most about a patient that had surgery at the East Bay Surgery Center, and the feedback that they gave you that you remember. And Dr. Froelich, we talked a little bit about this before. what do they say when they recover from surgery and their experience at the East Bay Surgery Center from a same-day total joint procedure?
Kings and queens. They feel like they are royalty. They feel like that the staff is at their beck and call, and they really appreciate that the attention and that all their needs are being felt. And I think that is a extremely consistent perception and reality that is part of the care process that we've set up.
And Dr. Cohen, I'd like to ask you the same question. What is some of the feedback you've heard and that you remember and it keeps you going?
Yeah, the feedback's been great. Everyone's had a wonderful experience, and a lot of comments are, why did I wait so long, and why didn't I do this sooner? And I can't believe that I'm walking better after surgery than before. And that goes to the whole surgical team, the anesthesia team, pre-op planning with the Steve Proprietary and the total joint class, as well as our physical therapists that work with them.
And Dr. Ntochi, same question to you. What's your takeaway in right now that feedback that you remember and take with you?
You know that show Cheers, where it seems like everybody's just forgetting it by now. Maybe I'm just aging myself, even though everybody thinks I'm quite young. But it's where everybody knows your name. That applies to University of Orthopedics. I should start. We should play this on the way out.
That's a great idea. And I'll ask Dr. Jenkins, same thing. What's your takeaway, and what's maybe the best feedback you've heard from a patient?
I mean, I think just like all the other guys have said, it's just the experience, and they feel that they don't live the identity of being a patient in a hospital. They're a human being. They're treated as a human being, and like it's like a 5-star hotel. There'd be a mint on the pillow, but you have to be NPO. It's like nothing else. And they come back and they're grateful, and they remember the name of the nurse that cared for them, and the CNA that traveled with them in the car. And their physical therapist. And as Val said, one of the benefits of practicing in Rhode Island and not in a big city somewhere is, we're a community here, and everybody knows everybody. And, you're really treated like, like your family, or you're a friend, and you're part of this. And, we're all neighbors here. And I think that that really comes through in providing this service to patients. And I think that, they're really grateful. They're grateful for it. The implants and the surgical techniques, it's all the same stuff that we do in the hospital. There's no magic, there's no magical laser beams or, anything different, that we do or anything like that. It's not about that. It's about all the other stuff. It's about the experience and organization and safety net and that we call those patients that night, that makes the difference. And I think that, those are the things I hear, They say thank you for that.
And Dr. Barrett, your final thoughts and what you'd like to end on as far as the advantages of the same-day total joint procedure at East Bay Surgery.
The biggest thing that struck me is that the patients will come in, for a 2-week visit, and they'll be surprised at how easily they got through this. When you call patients at night and the following morning after their operation, they're generally surprised at how smoothly things have gone and how well they're doing. Being at home in their own, own environment, sleeping in their own bed. I think that's one of the things that struck me the most. I've had a patient who had replaced his knee at a hospital, and then we did his other side at the surgery center, and he kind of was like, why didn't we do this the first time? This is, this was, the way to go. And I think that we kind of hear that very frequently, that, the patients are extremely happy with the service and how smoothly things go, at the surgery center.
Great. Well, thank you all. We are wrapping up. If you have any questions, please feel free to send us an email or get them to us. We'll get back to you, whether it's on Facebook. Actually, we just had one come in here, and maybe we'll take this one as our last one. Dr. Froelich, we talked a little bit about this. Are robotics being used in total joint replacements? Is that something that is going on, and something that you're looking toward in the future? And we'll maybe end on that last question here before we finish up.
Sure. We currently are not using robotics because really the current literature does not really show any substantial advantage to that. I think the panelists would agree with me that I think it can help someone who is less experienced. But for the 4 other folks that are on this panel with me, these are fellowship trained individuals who have been doing this and doing the, as my wife would say, I'm not very smart, but there's a couple things that we do, and we do it really, really well. And I think one of the takeaways that people, whether robotics are involved or not, will agree on is that the best outcomes are the result of surgeons that have done a lot and facilities that have done a lot. And the 5 of us here collectively have gazillions of years with gazillions of patients. So it's not our first rodeo. We really know what's going on. And yes, we don't use robotics, but there's plenty of other referencing devices that are used as part of the replacement process. It's not, as I tell my patients, it's not like I run out to Home Depot and pick up a hinge. You know, this is still a very sophisticated operation, or operations that are done in a very sophisticated and specific fashion. And that's why we have the results that I don't think anyone can beat. And that is the truly reproducible process with unbelievable outcomes.
Great. Thank you all for taking the time tonight, and everyone at home on Facebook and Zoom who tuned in. And again, if you have any questions, send them our way and we will get those answered. And feel free to visit universityorthopedics.com, reach out to any one of these surgeons in their offices. They will get right back to you, get you in to be seen. This time of year, you'll love to drive over to Kettle Point to take a look. You can take a walk around there any time of the year, right down the bike path. So you can go see it for yourself. So thank you all again for taking the time tonight. Really appreciate it. It was very informative.